Good morning, everybody. Please allow me to present my PhD thesis with the title Optimizing Radiotherapy in Pediatric Brain Tumor Oncotherapy. My name is Renáta Kiss-Miki. I'm a first-year PhD student at Semmelweis University, and my mission is to give a better life with less side effects in pediatric brain tumor survivors. And my vision is to help the pediatric brain cancer patients and the researchers to improve the quality of life. For this, I'm running two projects, in both of them investigating radiotherapy modalities, the efficacy and side effect profile of this. In my first project, by performing a systematic review and meta-analysis, I am investigating the efficacy and side effect profile of radiotherapy modalities used in the treatment of pediatric brain tumors. As we know, childhood brain cancers are more than 20% of all pediatric malignancies, and more than 80% require irradiation to provide optimal survival. Radiotherapy have a lot of irreversible life-threatening side effects like the neurocognitive decline, endocrine deficits, or neurological problems such as hearing loss. So our aim is to find the least harmful yet effective radiotherapy modality in pediatric brain tumors. There are two major types of radiotherapy, the proton beam and the photon beam. The photon beam is the oldest one, but it made a huge development in the last decades. The proton beam is used from 2007 with a lot of promising outcomes, but still requires some research based on efficacy and side effect profile of it. So, based on this, our clinical question is, which irradiation method is the least harmful, still effective for children treated with brain tumors? We are investigating children with brain tumors, comparing the two major types of radiotherapy, the proton beam and the photon beam, and measuring the survival and frequency and severity of side effects. Our hypothesis is that the CyberKnife method, one of the photon radiotherapy, improves the survival and decreases the number of adverse impacts compared to the other types. We performed a systematic search at the end of November last year in 4 databases with around 4,800 hits. And after the selection and reference checking, we get 54 articles eligible for full text selection. Here you can see the list of my outcomes we are measuring, and as measure of effect we use the odds ratio, the 95% of confidence interval, and the mean difference. If an odds ratio is equal with 1 in the next coming plots, it will mean that there is no difference between the two radiotherapy modalities. If it's lower than 1, it means that proton radiotherapy can be beneficial in different types of outcomes measured. If it's higher than 1, it means that the photon radiotherapy will be the most effective. And in the next coming slides, I would like to present some of my results. In this plot, we investigated the 5-year overall survival in case of patients who get photon or proton radiotherapy. This is very important because there is still a huge discussion in the literature about this topic, which one is the most effective for children. All of the included studies are retrospective cohort studies, and we get a homogeneous population with around 500 patients included. In this case, as measure of effect, we use the odds ratio, which is equal with 0.8, which means that neither statistically nor clinically significant differences between the two radiotherapy modalities, but we can see a tendency that proton radiotherapy can be beneficial in this topic, but more research is needed and more studies to clarify this. As a next outcome from the adverse effects, the hypothyroidism, one of the most frequent endocrine side effects, is measured, and in this case also the included studies are retrospective cohort studies. We have a homogeneous population with around 900 patients included, and here we can see a clear effect with an odds ratio equal with 0.17, which suggests to us that if we are using photon radiotherapy, there is a 6 times higher chance to develop hypothyroidism as in case of photon radiotherapy. And this was also a statistically significant result. Another outcome, side effect from the neurocognitive decline group is the IQ level. In this case, we used as measured of effect the mean difference, and here we have also a clear effect which shows us that in case of using the proton radiotherapy, we can increase the IQ level with 12 points as in case of photon radiotherapy, and this was also a statistically significant result. The strength of our study is that only comparative studies are used, and we are measuring a high number of outcomes, but we have also limitations such as the low number of articles or the missing data due to data collection. As conclusion, we can highlight that based on 5-year overall survival, there is no difference between the two radiotherapy modalities, but based on the side effects, the proton radiotherapy can be beneficial for children with brain tumors. As an implication for research, we can suggest performing more two-arm comparison studies, and in studies to investigate the side effects based on the CTCA scale. Here you can see the progress of my first project. Now we are finalizing the tables and the figures for the rest of the outcomes, and meanwhile I'm writing the manuscript, and I'm planning to submit my first article this year on May. In my second topic, by performing a registry analysis, I am comparing doses and side effects of radiotherapy in pediatric central nervous system tumors. As we see, there was a huge development and advance in radiotherapy modalities in the last decades, resulted with promising outcomes in tumor management. And let me remind you just a few types of photoradiotherapy that was developed in the last years, like the intensity modulated radiotherapy or the stereotactic radiosurgery. But there is still a lack of protocol which described precisely which dose can be used for children to reduce the side effects, for example, the neurological side effects. So our aim is to investigate the side effects of different irradiation doses among children with central nervous system tumors. And the clinical question in this topic is, what is the minimal yet effective dose that reduces the neurological side effects after treatment? We are enrolling children with brain tumors, comparing radiotherapy dosages and measuring the neurological side effects. And our hypothesis is that the lower radiation dose can minimize these side effects with a retained efficacy. And we are doing this to provide data for a protocol establishment. As registry, we are using the National Childhood Cancer Registry, which was established 40 years before, and it has a network-developed database also. Patients from all over the country are enrolled, and every year a follow-up document is needed from every patient. We can find general data about the patients in this registry, but also data about the grade, localization, all histological type of the tumor, and the treatment methods used. And now we are at the stage of data collecting in this project. To sum up, I would like to finish both of my projects in this year, the first one in May and the second one at the end of this year. And I would like to end my presentation with a quote from Nido Kubin, who was a Lebanese-American businessman and self-motivator. And he said, when a goal matters enough to a person, that person will find a way to accomplish what at first seemed impossible. And thank you for your attention.
Thank you for your presentation, and my question would be regarding to your first project, that what side effects has the most impact on the quality of life of the patient? Thanks.
Thank you for your question. As we know, there are acute side effects and long-term side effects also. Concerning the survival, the acute side effects would be the most important, but as many children survive after treatment, I think that the other ones, so we have to focus on long-term side effects, like, for example, the neurological side effects or the endocrine side effects, because this can decrease the quality of life of children. So I cannot highlight one of them because all of them are important.
I'd like to ask a question regarding to your first project too. What was the type of your included studies? These were RCTs or cohort studies, or what was the certainty of the evidence regarding to your results?
Thank you for your question. All of the included studies were retrospective cohort studies because in this topic it can be done on RCT, so I can find one of them, and I think it's something undoable in this project. And the level of evidence it was, if I remember, it was good, so it wasn't a problem.
Could you tell us a couple of words about the clinical heterogeneity of the studies? So were there differences in the size of the tumor in your meta, or the doses of the radiotherapy, or the location of the tumor, and what do you think can that affect your results at the end? And I have an additional question regarding your second topic. What will be the different doses of the radiotherapy that you are planning to compare, and why?
Thank you for your question. For the first question, most of the included studies investigated medulloblastoma as tumor, but I find also studies where other types of tumor were also investigated. So probably this could highlight the heterogeneity of the population, but in the first two plots, the 5-year overall survival and in case of hyperthyroidism, there was a homogeneous population, so it wasn't a problem to access. As the localization of the tumor or the size of the tumor, in most of the articles it was mentioned, and of course, if we know which type of tumor, we can assess where it can be localized. But it was described in most types in most of the studies. Regarding to the second question, we would like to group the doses into groups: the high dose and the low dose. And in case of low dose, we are planning to investigate from 23 gray to from 80 gray to 23 gray, and below that, below that to 54 will be the high dose range. So we are planning to analyze in this way.